What got me interested in medicine was that chance to not only get to know patients over a long period of time and establish that relationship with them, but also to feel like I was having a difference and making an impact on their lives. The way I approach medicine and caring for patients is really a shared decision-making process. So what that means is that I might make recommendations based on national guidelines that have been issued by professional physician societies like the American Cancer Society and so forth, but I try to apply that in the context of the patient and their family and their particular situation. So we really try to tailor our treatment and recommendations based on what's best for the patient and keeping that in mind. We feel that the best treatment is the one that the patient feels most comfortable with. Colorectal cancer is actually one of the most preventable and treatable cancers out there. 75 to 80% of all colorectal cancers could be prevented by following the screening recommendations. Not only can we prevent colorectal cancer with the screening test because we can detect precancerous growths and remove them before they turn into cancer, but also even if a cancer has developed, if we catch it early enough, it can be curable. In my everyday practice, as I do colonoscopy screenings, I see many patients where we detect large precancerous growths or even early cancer, and the patient had no idea that they had this growing inside of them. They had no symptoms at all, and they just came in for a screening colonoscopy because their primary care doctor recommended it. And it's really rewarding for me to, after the test, be able to tell them, it's really good that you came in today because we were able to remove this precancerous growth and prevent you from getting colorectal cancer. And many times these patients, they tell me that my doctor's been telling me to get this done for years, but I was scared and this really wasn't as bad as I thought it was going to be. And for them to come in and for me to be able to find and detect that precancerous growth that I know would have turned into a cancer within a few years, but for me to be able to tell them that I went ahead and removed it today while you were during your test, and because of that, you've prevented yourself from getting colorectal cancer, that's one of the most rewarding things of my job. In the last few years, we've noticed that younger and younger patients are being diagnosed with colorectal cancer. And so because of this, we've established an early onset colorectal cancer clinic specifically to focus on these patients because these patients may have different concerns and priorities compared to older patients who are typically diagnosed with colorectal cancer. So these are patients that are under age 50 who may be balancing taking care of young children while taking care of elderly parents, patients who may be trying to grow their family, trying to have children and may be concerned about fertility issues, and just people who are trying to find other people to get support with others at younger ages with colorectal cancer. And so this early onset colorectal cancer clinic tries to focus on all of these issues that are specific to younger patients. I'm really hopeful for the future of clinical care because I think there are so many advancements that are coming on the horizon that will really be great for patients. One is, in my field, colon cancer screening, there are blood tests that are being researched. There are very sensitive stool tests. So there are these great non-invasive screening tests that are coming down the line that could be great options for patients in the future in terms of having even more sensitive colorectal cancer screening tests. In the past, patients who were diagnosed with colorectal cancer, if they weren't able to be cured by surgery, then they might have to have chemotherapy. And that chemotherapy used to be the same for everyone, regardless of what type of colorectal cancer they had. Whereas nowadays, now we're looking more at the exact genetic mutations that each colon cancer has, and then tailoring the treatment, the chemotherapy, specifically to target that patient's individual mutations in their tumor. And so that makes it a lot more specific treatment and also gives you a lot fewer side effects. So when I see a patient that I've newly diagnosed with colorectal cancer, and I'm able to tell them that we caught it early and that they have a very high chance of a complete cure and living a normal life, it's a great feeling. Because of the screening tests that we've done, we've been able to save this person from dying from colorectal cancer. And I have patients now that I've seen, more than 10 years that I've known who are living healthy, normal lives, who've gone through colorectal cancer and they've survived it. And not only that, they've thrived because not only have they gone back to a normal life, but they now have a greater appreciation for their life having gone through this process.